Go.
Hi everyone, we're going to do a very quick demo on what it should look like when you go over consents with families. This is the folder that you get on the bedside clipboard on admission, and basically you should be sitting down either on the couch or somewhere in the room with mom and dad if they're available to go over everything in this folder at length. So I'm just going to kind of give you a basic demonstration of what this looks like when I do it. There's lots of right ways to do it. You don't have to mimic me exactly, but it kind of gives you a little bit of wordsmithing to work with if you're not comfortable with this process. So the first thing I do is kind of the way this is organized. Of course, on the left is just all the informational type things. On the right is usually more the consents. So I just pull each one out and briefly kind of go over. This is your breastfeeding journal. We recommend that if you're breastfeeding, you can kind of utilize it. It's got tips and tricks. It's got a little schedule in here, a pumping journal that you can use to kind of make sure that you're keeping track and pumping as often as you need to be. So I usually just say they can go through that. And whenever they've got some free time, and then ask questions to either us or lactation if they need that. The next thing you're going to see is our little developmental care by the week. So keep in mind that the more premature the baby, the more of these that you're going to find in there, and just kind of let the parents know that they're a great resource to go over, and it'll kind of help them to understand and know what they're going to need to expect from their baby at each gestation that they go through. These are also the same ones that we keep in the little laminated files at the bedside, so if you need to reference these with the parents and they don't have their notebook with them, it's the same stuff. Right. So the next little piece is just Welcome to Mercy Children's Hospital. This just has information about being at Mercy. It's got maps in here, contact information, things like that. The thing that I usually try to point out to parents is it has this Parents as Teachers early childhood education program, so they can fill this out at the bottom if they wish to enroll as part of that program. And then we also have our NICU parent guide. So this goes over kind of another family participation guideline page, talks about like people that you might see in the NICU, how to enter the NICU, different things like that, common conditions. It's got information about TTN, jaundice, RDS. So if you have a baby with that diagnosis, you can kind of reference that as something they can read over if they need extra information. The other thing it talks about is discharge criteria. So this has the top 10 requirements for discharge, so that's kind of helpful for parents to know what we're looking for before their baby can be discharged. The last couple things are related to car seat safety, so you can just kind of point out that there's a little flyer in here about car seat installment, and this little flyer has some information from the Mercy Injury Prevention Center that they can call if they have questions about car seats or booster seats. So that's kind of concluding all the information they can read on their own time. And then we'll come over to the other side and start the consent portion of this. The first thing you're going to find in here is privacy practices. And I basically just tell them they will get a copy of this pretty much on every unit that they go to, so they've probably already seen this from labor and delivery, but it's just Mercy's duties as a hospital to them as the patient. Okay. These might not be in the exact same order that I'm working with here, but the next one I've got is just our visitation guidelines as it relates to COVID, which you should all be very familiar with, but just point these out to the parents. They can read over them. The second half kind of talks about quarantine versus isolation, if they need to do any of those things while they're here with us in the NICU. The next form is for Ronald McDonald House. So we do have this new COVID-19 family entry screening form that they have to fill out. This is very much updated, hot off the press. They just changed these guidelines on the 23rd of December, so you may not have seen this new one yet. But basically it asks some questions of the families. If they answer no to all of these questions, it does not mean that they don't qualify for Ronald McDonald. It just means that Ronald McDonald will be asking for more information and kind of trying to get to know what the situation is with the family. So just know that if they're saying no to some of these, it doesn't necessarily mean that it'll be a hard no from Ronald McDonald House. So once they fill out that screening form, then you're going to have them fill out this referral form, and I usually go ahead and fill out the top part for them because they may not have all that information, and then I have them fill out the middle and the last part because they will know this better than we will, and then it will need to be signed by the RN with the date. They're currently only doing overnight use, but I did talk to them today and confirmed that it's a common misconception that if a family lives in Springfield, they don't qualify for Ronald McDonald House. That is absolutely not true. They give first priority to those families that live out of town and far away, but if they have availability, which they frequently do, they are happy to accommodate Springfield families that would like to be closer to their infant or that maybe have transportation issues or things like that. So please use this liberally. If you have a family that you think would benefit from Ronald McDonald House, fill out the referral and let Ronald McDonald House kind of make that decision from there. Our next one is infant security. So this kind of addresses what measures we have in place to make sure their child is protected. So the first one speaks about the electronic bracelet, the hugs tag that most all of our babies have on, or at some point during their NICU stay they will get. And we just want to let them know that that will stay on and activated during their hospital stay. And what that does is prevents them from leaving the 5th floor or getting near exits on the 5th floor without alarms going on. And that's just a safety mechanism to make sure the baby doesn't leave the floor without staff knowing about that. All staff members who are allowed to handle the baby wear photo identification, so just make sure and educate them that no one should be coming in their room to talk to them or to do anything with their baby without identification on. If someone does show up in scrubs with no identification, they need to alert their nurse immediately, because we don't want anybody interacting with them that doesn't need to be there. If your baby needs to leave your room without you, they'll be transported in a bassinet. No one will ever carry the baby out of the room. That's not hospital policy, so just know they should always be transported via a bassinet. They should never leave the baby unattended in the room, so mom can't go down and smoke if the baby's in the room with them. They shouldn't be going to the bathroom and leaving the baby in the room unattended just to keep the baby safe should there be someone in the hospital lurking. It also talks about continuing to safeguard the infant after they leave the hospital. It's a good idea to have pictures with written description just in case something were to happen. We don't recommend announcing the baby's arrival with balloons on the mailboxes or things like that. Those practices are not considered safe by most safety experts, so they're highly discouraged. And then the last thing is just make sure they know that no healthcare provider will be visiting their house without prior arrangement. So nobody should be coming over saying that they're with Mercy, here to check on the baby. That's a practice that some people were using to abduct infants. They would ask for a glass of water, mom would go to the kitchen to get the water, and they would take off with the baby. So they should be well aware if someone's coming to their house, and they should have proper identification on them. This next form is our PHI communication form, and this is what allows us to give information over the phone. So we recommend that mom and dad both be on this list so that we can give them updates. They can also name up to 3 other people that they would like to have information over the phone. The one thing I always make sure and tell parents is that if you put these people on here, we are allowed to give them information, but we prefer to give parents information first and let the parents communicate that with the rest of their family members. So just know that if we've got, a grandparent on here, we can't always guarantee that we wouldn't accidentally give them information to the grandparent before mom and dad hear it. So they need to be okay with that if they're going to put their names on these sheets. Otherwise, just put the parents' names on here, and the parents can be responsible for communicating any changes in the infant status to family members. They can change this at any time. It's something that can be fluid, so if something changes during the hospital stay and they want to add to or take away, that's perfectly okay. Alright, so now we have transfusion of blood and blood products. So we do like to try to get this on every baby on admission, and we explain to the parents that it's very frequent that we have to transfuse here in the NICU. Most of our preemies end up with at least 1 blood transfusion, but as we know, most of them get way more than 1. And so just kind of explaining that the reason for that is babies don't have the ability to recreate their blood cells fast enough, and we take a lot of blood with blood draws and things like that, so oftentimes they need a little bit of a boost. The blood that we give to babies is very different than the blood we give to an adult, and it's got a lot of different safety measures in place that keep it very safe for the babies. So I always kind of say I've worked, in the NICU for about 14 years now, and I've never seen or heard of a baby have a blood transfusion reaction. It is always a risk, but it is an extremely low one, and the benefit far outweighs the risk for most of our infants. Also make sure and let them know that just because they sign this consent on admission doesn't mean that we would just transfuse their baby without their knowledge. That would only usually happen in an emergent situation, but usually if the baby needs a blood transfusion, we have the ability to kind of call them and let them know that that's happening. It shouldn't really come as a surprise to them if they walk in, things like that. So it's nice to have this on hand from the get-go just in case we were to need it emergently, just kind of going over all those pieces. So our next consent is our treatment authorization. So this is basically, the way I explain this to parents is this is giving us permission to do what we've already done to your child, because by this point when they come in, oftentimes we've already started the IVs and given fluids and nutrition and things like that, but we do still like to get this consent for treatment. It allows all of our physicians and their partners to care for their infant and provide treatments and diagnostic procedures as they see necessary. This is also a really good time to just let the parents know that we have almost 5 neonatologists and 4 nurse practitioners. Almost 5, 4. I'm consulting my video person here. Anyways, however many we have or that are coming, kind of let them know that they will see one of them each day, but it may not be the same person every single day, and it may not always be a physician, because our nurse practitioners work very closely with our physicians, kind of help prepare them for that from the get-go so their expectation is realistic. All right. I usually say about that. Even though this consent includes blood transfusions and blood products, we do still have to have the official blood transfusion consent before we can give the baby a blood transfusion. All right, so the next paper here is actually referenced in the previous treatment authorization that I just went over, and this is basically just an informational guide that we give to families that goes over common invasive procedures that we would do in the NICU. It can be a little bit overwhelming and scary for our parents sometimes if you just hand this to them, so what I usually try to do is kind of take into account what the baby's diagnosis is and maybe what commonly would be something we would do for that particular diagnosis. If you've got a kid here that's here for maybe a 3-day rule out, there's a highly unlikely chance that they're going to maybe need like an intubation or a chest tube or maybe a suprapubic tap. So I usually just kind of say these are things that we might do. It doesn't mean that we will always do them, and we will usually, unless it's emergent, tell you that something like this is going to be done before it happens. All right, so our consent for use of photographs and videotapes or other recordings. So we do also like to get this on admission, and this is what gives us the ability to take pictures and put them into Haiku, things like that, that we use when we're maybe consulting with other physicians. It also does give us the ability to use some of these pictures for education purposes, although we don't usually do that without notifying the parent that we would like to do that up front. But it is helpful to have this in the charts in case we do need to use that Haiku function in a timely fashion. Also, if we have Amish families or Mennonite families, usually they are going to refuse this consent, and that is absolutely okay. If you have other families that are kind of like, I don't know if I really want that, that's okay. Just tell them that we will touch base with them if we feel like it's going to be something necessary during their baby's hospital stay, and it's not a huge deal if they don't sign it during consent. This last consent is our consent for PICC line insertion. So common misconception with this is this does not always have to be signed by a PICC nurse. I'm sorry, it doesn't have to be obtained by a PICC nurse. The PICC nurses do actually always sign it when we put the PICC line in, but it is super helpful if we anticipate the need for a PICC line that we go ahead and get this on admission when we go over all the consents. It can save us a lot of time in trying to track down the parents the day of the PICC line when it's needed. So just know that any nurse can get this consent. You guys are all very well versed in why we use PICC lines and how we use PICC lines, and as the PICC nurses, when we actually go to put the PICC in, we will sign the consent at the bottom and address any concerns that the family may have at that time. The other consent, it's not a consent, but the other form that's usually in here is our family participation form. So you guys should all be pretty well versed in that, and of course right now we're not letting families in, but when the time comes that we do, just know that that form, we typically tell families we do not let them change it once they've filled it out, which is unlike that PHI form that we talked about in the beginning. So that's just kind of a rundown of how I go over consents with families. The other thing I will do is usually I cover all of them, I talk about all of them at one time, and then I give them back to the family, and I give them a few minutes to kind of read over all the consents so they don't feel pressured into signing something that I have just discussed, that they can actually kind of go through and read it if they want to. It is important though that they do sign the consents before they leave the NICU. They are not allowed to take the consents to a different room. We actually have to witness most of them, so we need to be present when they're going through and signing them, and then we need to make sure and be diligent that we are signing the witness form, because if we don't have it witnessed, then the consent is no longer or is not valid. All right, and that pretty much wraps up how I complete consents. Thanks for listening.